This is a beautiful spring day. Happens to be a Sunday afternoon. As I approach doing this video, I just did one, and it came from the Johns Hopkins research material, and it was on hypertension. Now this one I'm following up right afterwards, and it's by Johns Hopkins. I'll say it right in a minute. But this one's on stroke. And it probably is approaching 70 degrees, as I said, on the patio here. And it's really a good time to do some of these videos, and gets me out into the open. But as I take a look at this one and try to put together some thoughts on it, what is a stroke? Most of you know what it is. Sometimes it's called a brain attack. It occurs when an artery supplying blood to a portion of your brain becomes blocked, or there's a rupture occurring. Blood flow interruption is part of a brain, and the neurons or the nerve cells or whatever is affected. And it's typically starved by or from oxygen. Few hours of interruption, complete interruption, and your brain function is gone. Sorry, the neighbor is mowing the yard. You have to put up with that one on this one. That's the problem with doing a video outside in the patio. But nerve cell damage due to stroke is usually permanent, unfortunately. Well, there are types of strokes. About 80% of all strokes are ischemic, and that results from a blockage in the blood vessel. Then there's the thrombotic stroke, and it occurs when a blood clot forms along the wall of one of the major arteries. And there's an embolic stroke. It occurs when an embolism breaks off and travels through the bloodstream until it lodges in a smaller artery. And there are hemorrhagic strokes. Counts about 20% of all strokes. Occurs when the artery in the brain tears or ruptured and the blood leaks into surrounding tissues. Unfortunately, that type, I've been told, again, I'm not a doctor, most of the time requires brain surgery to stop that leakage. Now, what are some of the risk factors for a stroke? Well, there's clotting, and it can be caused by age, family history, and that obviously can't be modified. We can't choose who brought us to this world, but we can do something about it while we're here. So age, gender, family history, race, and ethnicity, whatever, can't be controlled. But just like in heart attack prevention, just like in hypertension, there are a lot of risk factors that are very similar. Oh, one of them I just forgot to mention. If you've had a previous stroke, two of them, there are 14% likely that a repeat stroke is going to reoccur in a year. The risk after that is down to 6%. So get by that first year. Here's one that I wouldn't have thought about, but I need to pass on. It's the low birth weight. If you know and your parents have told you that when you were born, you were 5.5 pounds or less, indications are you're likely to have a stroke in adulthood, more so than if you weighed over 8 pounds. I was told when I was born I weighed 9.6. Not necessarily considered a big baby these days, but it was then. Well, there are other factors, bones fragments, obviously open heart surgery, lung problems, whatever. But factors that can be changed. Quit smoking. If you have diabetes, try to control it or find ways to maybe even eliminate it. There's some things out there that says it can eliminate it. Obviously, reduce your blood pressure. Find out what your neck blood pressure is. When you've gone to a doctor and he does blood work and checks you out, most of the time, I'd say all the time, but I don't know your doctor, is going to check your neck. And that's to see how likely you are to have a stroke. And obviously, heart disease can be a factor. Abnormal lipid levels. Those are your cholesterol and your triglycerides and whatever. So you can get a blood workup and find out what those are and keep those lower. Now, there are two kinds of cholesterol. One an LDL, which is the low density, which is the bad, and the HDL, which is the good. All contribute somewhat, but the LDL, the high density, can be a little higher and actually help you in certain aspects and not be a major factor, at least according to Johns Hopkins they're talking about. Now, when your heart feels like it skips a beating, that may be cause an oncoming stroke or one that's there, and you need to have it checked out. So don't let those kinds of things pass you by. And a newly recognized stroke risk is C-creatinine, CRP. It's a substance produced by the liver, which when it's inflamed in the body, it gets into your blood vessels and it starts helping or blocking, shouldn't say help. So ways to lower that includes, of course, physical activity, weight control, aspirin or statin drugs. That's low cholesterol drugs. But as in with hypertension, got to be careful about aspirin and pain control as well. You know, the obvious things that I can tell you that you've already heard about. But since this is what this is, I'm going to tell you anyway, just to complete it. Obesity is a major concern for stroke. 50 to 100% of people who have a stroke are obese. An unhealthy diet, physical inactivity, metabolic syndrome have at least 3 of the following characteristics. There's 5 of them, but they have at least 3 of them. High blood pressure, fat around the abdomen, low HDL cholesterol, high fasting triglyceride levels, and high fasting blood glucose levels. Most of those, probably all of them, you can only find by having blood workup from a doctor. Hormone replacement therapy also can increase your risk, especially if you're getting a hormone, either estrogen or otherwise, to to increase health. Can work in adverse effects in this. Alcohol or recreation drugs. Now, I will tell you this. I don't drink alcohol, none. I've never had a recreation drug. If you've had one, you're at risk for more than just whatever the drug causes. And then, of course, there's chronic stress, and you need to try to eliminate that if possible. Symptoms of a stroke. You probably know the symptoms of a heart attack. Well, it's just as important to know the symptoms of a stroke. Possible symptoms is southern weakness or numbness in the face, the arms, leg, one side of the body. Mental confusion, slurred vision, sudden severe headache, unexplained dizziness, nausea. All of those are symptoms of heart attack as well as a stroke. Actions to take immediately. Stay calm. Don't downplay any of them. Call or have someone call an ambulance. Maybe even take an aspirin, especially if you ever talk to the doctor about it. Now, again, I'm not a doctor, so I'm not prescribing you take an aspirin in this case, but I'm just saying that some do. You see that even television. And if you can't get an ambulance there pretty quickly, see about getting somebody else to take you to the doctor. Because the time waiting between that and you get help is critical. It says that there are some anti-platelet blood drugs that can be used, and if you've had a stroke, your doctor may already have you have one handy, just in case you have another one, especially if you're going to have that 14% in the second and after the first year. And again, Johns Hopkins talks about using an aspirin, but your doctor probably is the one who should count on recommending that. If you've never gone to a doctor for it, do not start taking it without talking to your doctor. And there's a lot of other things, just some crazy names that probably your doctor will tell you about. But anticoagulants, excuse me, you can say it right in a minute, are called blood thinners. And those are important for reducing strokes, whatever. One of the most widely used recently is warfarin. Extremely effective in preventing emboli, which is associated with high risk of excessive bleeding. And now they've said, if you can trust some of the things that they're talking about, you want to talk to your doctor again, that there are a couple of them out there now that might even be better than warfarin. Don't know that for a fact. But there are drugs that can help you for drug types. There are the antiplatelets. The aspirin is one listed. Plavix is another one. Then there's anticoagulants. Coumadin or warfarin is one they talk about a lot. Statins, which is a drug to lower your cholesterol. And unfortunately, surgery. If it involves someone that goes one of your neck arteries. They can do that without a major surgery, although it should be done in a hospital, and probably should have some kind of a pain reliever for that. But they're making an incision in one side of your neck to relieve that, and either to help stop the blood or to do whatever else the risk is there. Several things that we've talked about, and certainly diagnostics of a stroke are vital. If you know your history as a family, if there's been a stroke in your family, you should be aware of them and have certain things tested. I have. And I found that I have absolutely no blood clots, very good heart, no out of rhythm, blood pressure in a reasonable level. But you need to know your history. And then you need to have a physical examination, laboratory test, whatever. All these involve ultrasound scans. CT scans are important. I've had a couple recently, just to make sure. MRI scans are another one. And did you know that all of these scans, ultrasound, CT, MRI, even some of the things that are involved with the internet and whatever, and certainly our things in space that now allow us to have internet come over and whatever, have been developed because of space travel. Most of you probably knew that, but I suspect many didn't. Probably some of you probably said, well, what are we having space travel for? Well, it's because of all these inventions come from that. All of these things are truly coming from those kinds of things. And just this morning, SpaceX, the first non-government spaceship, docked on the International Galactic Space Galaxy space station, the one that does the signals back to Earth. And we can do all kinds of picture transmission and sound and whatever. They docked this morning, first one. So all of these good things that will help us live longer are an outcome from these kinds of things. You should understand that and be aware that our ventures to space are really good. Thank you for watching. Hope you enjoyed it today. God bless you.